Are you pregnant and you want to learn about feeding your baby without judgment? All the important stuff and none of the fluff? You're in the right place. Hi, I'm Erin. I am a pediatric nurse practitioner and an IBCLC. Make sure to hit subscribe and follow Baby Feeding Coach across all platforms. In this series, I'm going to walk you through all the important information that you need to know before you have a newborn. There are a lot of feeding classes out there, but this one comes from the unique perspective from a pediatric nurse practitioner, so someone who is working in clinic in a pediatric office, and an IBCLC, so somebody who is focused in lactation and feeding babies. Feeding is one of the most frequent things you're going to be doing with your newborn, but it can also feel very overwhelming when you're in it. My goal is to give you evidence-based information without the fluff so you can confidently handle any kind of challenges that come along your way. This is part 1 of 5 about feeding your baby in the hospital. So whether you are breastfeeding or formula feeding, this information is very relevant. Make sure to hit subscribe so you will be the first to know when parts 2 through 5 are live. Let's start at the very beginning. You've done the hard job of labor and delivery, and now your baby is with you. So your OB or your midwife has placed your baby on your chest. This is referred to as the golden hour. The golden hour is a wonderful and tender time where you can bond with your baby. So your OB or your midwife puts your baby on your chest. It is great for your baby for temperature regulation, heart rate regulation, and blood sugar regulation. It's good for you because it gives you all these lovey hormones and really just helps usher your baby into the world in a really comfortable way. Your medical team should not take your baby from you unless there is a 100% absolutely necessary medical need. It also helps trigger your baby's natural reflexes to find the breast and start feeding. But even if you're planning on bottle feeding from the very beginning, it's still very good and beneficial for you and your baby. Let's talk a little bit about hospital feeding routines. So in an ideal world, you are initiating breastfeeding or feeding your baby via a bottle in the first hour after delivery. Sometimes it doesn't happen like this, but in an ideal world, this is what happens. Then from there on out, we're feeding babies on demand no longer than every 2 to 3 hours. So sometimes we hear this in our brain and we think, okay, every 2 to 3 hours, that means I am going to feed my baby on the 3-hour mark, and we'll feed them 8 times in a 24-hour period. But what I like to say is it's feeding your baby on demand based on their hunger cues. So if they're showing you that they're hungry, you're going to feed them, whether it's been an hour and 15 minutes, an hour and 45 minutes, or 2.5 hours. Babies don't often follow the clock like we expect them to. Feeding on demand no longer than every 2 to 3 hours lasts until feeding is very well established. Your baby is gaining great weight with your pediatric provider, and you are feeling comfortable, and your pediatric provider is giving you the go-ahead that your baby can sleep longer stretches at night. The timing on this really depends on each individual baby. But just know that it is not uncommon for a baby who is getting breast milk to feed somewhere between 10 and 12 times in the first 24 to 48 hours of life and on. This is great because more frequent milk removal will mean that your milk will come in sooner. So it'll transition from colostrum to more mature milk faster the more your baby is removing from your breast. Let's talk about colostrum. Colostrum is the first milk that your baby will get if you intend to breastfeed. It is thick and rich and filled with important nutrients that are protective for your baby. Do you have to give it to your baby? No, but is it great for your baby? Absolutely. Your body starts producing colostrum around the 16th week of pregnancy, and it is ready for your baby once they are delivered. Colostrum is packed with antibodies, important nutrients, and it helps your baby pass their first poop or their meconium. If you are intending to formula feed from birth, you have to decide, do you want to give your baby colostrum or not? And if you decide that you want to give your baby colostrum, you can do so by hand expressing and then giving it to your baby in a sterile syringe or on a spoon or you can put it in a bottle nipple. So you can use this in addition to formula because it still does pack a punch even if you're intending to formula feed from birth. Some babies may receive formula in the hospital either by choice or by necessity. This might be because of jaundice, because of low blood sugar, because milk isn't coming in as expected, or it's seeming like your baby has lost too much weight, or simply because you chose that is the best option for your baby. If you don't want to bring your own powdered formula or formula to the hospital will provide usually 2-ounce nurse sets of one of the formulas that they have a contract with. So this might be usually Similac or Enfamil, and it's ready to feed and sterile. So that means you just pop a nipple on the top, which they should give you, and then you feed your baby. But know that in the beginning, babies often don't need that 2 ounces that come in the nurse sets. So you might want to start with something like 5 milliliters or 10 milliliters, which is just a small portion of the 2-ounce nurse set, and follow your baby's hunger cues. If they still seem hungry after that, you can give them a little bit more. But if they seem like they're very satiated or they're not hungry, that's okay. You don't need to force your baby to take that whole amount. Then you continue to feed your baby on demand, no longer than every 2 to 3 hours. And know that sometimes formula-fed babies eat less frequently than breastfed babies. So what happens if you have a C-section? If you have a C-section, it is likely that your baby is going to be away from you right after delivery. So they usually take your baby to another area and make sure the lungs are clear. And so you might not feel okay to hold your baby for a little while after delivery. And that's okay. But if it has been longer than 2 hours and you're still not feeling comfortable holding your baby due to a variety of reasons, then you can talk to the nursing staff and see if they want you to initiate pumping until you feel comfortable holding your baby and putting your baby to the breast. If you are separated from your baby for any reason, initiating milk removal early on can really help your milk supply in the future. So that means that if you're separated from your baby, either hand expressing or using a pump, and then doing so every 2 to 3 hours. So really whenever your baby is getting a bottle, you would be pumping, even through the night if possible. So that might mean you are pumping anywhere from 8 to 10 times or even more in a 24-hour period to tell your body to start producing more milk. So to move from colostrum milk to transitional milk to mature milk. And that is it about hospital feeding. So make sure to stay tuned for part 2, where we will talk about hunger and fullness cues. We will talk about feeding schedules and what to expect after you leave the hospital. If this seems overwhelming, I highly recommend doing a virtual consult with somebody like me, an IBCLC and a pediatric nurse practitioner, if you can find one, who will help you with an individualized feeding plan for your baby.